Studies suggest that there are more benefits to the flu shot than just preventing a person from getting the virus. It finds the shots themselves may lower the risk of having a first stroke by 12%. And joining us this morning with more insight on the study and what it could all mean is Dr. Reena Mehta. Dr. Mehta, good morning. Thanks for joining us.
Good morning. Thank you so much for having me.
Okay, my first question is, how can the flu vaccine lower your chances for stroke?
So that's a great question. So this was a recent Spanish study published in the journal Neurology, where they looked at patients ages 40 to 99 years of age, and they looked at all of their risk factors for stroke, such as high blood pressure, high cholesterol, and they showed that patients who actually got the seasonal flu vaccine had a lower chance of having an ischemic stroke, and that risk was reduced by 12%. So the reason for this, or the mechanism of this, is unknown, but the thought is that the flu vaccine may actually have anti-inflammatory effects. And so if you think about it, a stroke is due to inflammation. You get inflammation in the brain, which causes a blood clot, which then reduces blood flow to the brain. Well, the flu shot has actually been shown to be anti-inflammatory, so not only preventing the flu or reducing the severity of the flu, but also potentially reducing the risk of cardiovascular events such as stroke.
And who does this benefit? Is it anybody who gets the flu vaccine, or is it certain population of people who have maybe some risk factor there for stroke?
It's for certain patients who have risk factors. So those patients who have known cardiovascular risks. So those people who have high blood pressure, who have had previous strokes, or who have high cholesterol. So if you know you have a family history of cardiovascular disease, this is the patient population where it reduced that risk of stroke by 12%. And so if you're a young, healthy person who has no cardiovascular risk factors, it's probably not going to change anything because, again, your risk factors are low. But if you're in that high-risk group, then absolutely getting the flu shot can not only prevent the flu, but also reduce that risk of stroke by 12%.
Now, I know you mentioned 12%, the reasons of why, this vaccine can help people in reducing stroke. It's not 100% going to reduce it, but it still has those benefits.
Absolutely. I mean, 12%, you might say, oh, well, that's a low number. But if you're on the fence about getting the flu vaccine, it's not going to hurt. And if it, gives you some anti-inflammatory benefit of cardiovascular risk, then why not? Why risk getting the flu? Why not get the flu shot? And then if it prevents a stroke, then, while 12% isn't a lot, and you may still get the flu, getting the flu vaccine might actually decrease your inflammation so you don't have as severe as a course of the flu, and maybe you can prevent getting some cardiovascular risks.
Okay, I want to go over what exactly is a stroke. What are some symptoms or signs that maybe you might experience a stroke, or what are some of the risk factors people need to look out for?
So there's different kinds of strokes. There's ischemic strokes, there's hemorrhagic strokes, and then there's transient strokes. And so I like to use the acronym FAST. So FAST is a good way to try to understand the symptoms of a stroke. F stands for facial drooping. A stands for arm weakness. S stands for slurred speech, and T stands for time to call 911. So if you notice any of those symptoms, facial slurring, arm weakness, slurred speech, you need to call 911 and seek medical emergency immediately.
Definitely a good reason to talk to your doctor if you're experiencing those. And real quick, flu season is just getting underway. What are we seeing right now? Are we seeing a lot of people getting the flu?
Oh, yes. We are in viral respiratory season. All sorts of viruses are out there. Flu is rampant early this year, and we are seeing a lot more than we have seen in past years, pre-pandemic times. And so lots of people are sick. Lots of people are getting the flu. It's not too late to get your flu shot. Absolutely go get it, because the studies show that about 2 weeks after you get the flu shot, you are starting to develop protective antibodies. And so while we're seeing a lot of flu, we're in the thick of the season, we still have many more months left to go while people are still going to be getting very sick.
Not to mention, we're getting into the holidays where people are going to be coming together. So this is all a good reason to just prepare and prevent from getting ill. Dr. Reena Mehta, thank you so much for joining us this morning.
Thank you so much for having me.